Functional movement is a term you might have come across, but what is functional movement? The nerdy name for it is developmental kinesiology, the movement patterns that come with us as human beings, being born as babies, going through different stages that no matter what part of the world you're from, if you're a male or female, regardless of anything else, we all move the same way. So developmental kinesiology or functional movement has to do with the biological patterns of movement, the biology of movement that we are born with. Where we fail when it comes to chronic issues with injuries or issues that we go to the body part and only treat that portion of the body has to do with the fact that while we were having those issues, the brain, the conductor, dictated to the body to shift the weight, to change the patterns of movement to accommodate the injured body part. You may not be aware of the injury, but it is taking place. So that as a result of this deviation from the biological patterns of movement and developing the pathological patterns of movement, we end up damaging other body parts. So you may have knee pain on one side, and then later on it's the other side, or it may be hip pain, it may be shoulder pain, and you wonder what happened. Why am I falling apart? If that's your story, it's because you've only looked at a portion of the issue. So what is the solution now? The solution is going back to the basic. Every baby is born without the ability to move or make a decision to reach and grasp objects. But at some point in their life, which pretty much is about the same months in every baby on this planet, we develop those things. There's an intelligence behind those movements because with the attempt to grab something, the neurological patterns are developed, the muscular development has been advanced, and all of those go together to create the movement, which is like a concert. So where we fail is isolating the part and not looking at it as in whole. And what we do is we use bands, we use weights, we use you name it, when in reality, somehow magically, we all developed what was needed to move and start walking without any of those. So why are we reinventing the wheels when all we have to do is go back and really implement the things we all did, and we all did it successfully. We all as infants were not able to move and we ended up moving. Of course there are exceptions with genetic disorders, so we're going to put that aside here. Developmental kinesiology or functional movement is how you rehab your body part and its impact on the rest of your body. It, in conjunction with postural neurology, will complete the concert, also known as the movement that you're seeking after. Your posture does not have to do with the aesthetics of things. Your posture is a reflection of your health. That's when everything is in the right place, and therefore this body, this machine, can give you the speed and the function that you were meant to have. Thank you for watching this, and I hope you gained some valuable knowledge and the common sense information that I presented to you. Take care.